autistic people are dying much younger than others, and much younger than we'd expect. And we're not talking about a few years younger. A population-based study in Sweden from 2016 suggests that autistic people are dying on average 16 years younger than others. And many other studies paint an even bleaker picture. I know that's really hard to hear. I remember reading those statistics almost 5 years ago and being totally shocked. But I think it was really important for me to read about those statistics, because doing so sent me down a completely different research path to what I was expecting. I felt like I needed to shift my focus to understanding why this was happening and what we could do about it. 5 years ago, there was only one study on the physical and mental health of autistic people that included anyone over the age of 35. Despite autism being a lifelong and what we call neurodevelopmental condition, which means that it's about the way your brain is formed before you're born, the vast majority of autism research focuses on the experiences of infants and children. And the lack of research on the health of autistic people as they age is really troubling, because the recent estimates suggest that over 2% of children, specifically 1 in 44, are now diagnosed as autistic by the age of 8 in the United States. So what is autism? You may have heard about it in popular TV shows and films, but I found that a lot of people don't actually know what it is. The diagnostic criteria outlined 3 core features of autism. The first is differences in social communication, which can make it difficult for autistic people to understand what others are thinking and feeling. The second are strong interests in a particular area, and some autistic people may even have encyclopedic knowledge of this special interest. The third is repetitive behaviors from early childhood. Autistic people are also more likely to experience sensory differences, including heightened or lessened senses to things like light, touch, taste, and smell. They tend to have a cognitive profile that prefers logical and factual information and may have difficulty adapting to change. And you might also know that autism is more likely to be diagnosed in males than females. And several points of evidence suggest that women and girls are underdiagnosed with the condition. We don't fully understand what contributes to someone being autistic. We know that it's partly accounted for by genetics and partly by other environmental factors. You might have noticed that I'm using the phrasing autistic person instead of person on the autism spectrum. And that's intentional. It's because it's the language that's preferred by the majority of autistic people in the United Kingdom and Australia today. But I might sometimes use phrasing like person on the autism spectrum to reflect the differences in personal preference. Because just like with almost anything, not everyone feels the same. And when I talk to people that don't know very much about autism, the main thing that they tell me is that they know it exists along a spectrum. And that's absolutely true. This means that one person's experience of being autistic might be very different to another person on the autism spectrum. There's also a spectrum of intellectual ability, with some people requiring full-time care, and others that you may live or work with. But I actually want to go beyond thinking about only autistic people as being part of that spectrum, and make you aware that we are all, in fact, part of a spectrum of autistic traits. We all have varying levels of traits like pattern recognition and attention to detail. And we can think of people who are diagnosed as autistic as being on the upper end of that overall spectrum. But we all, whether or not we have a diagnosis of autism, have varying levels of autistic traits. And that's a great thing. Neurodiversity describes the idea that autistic people and people with ADHD, mental health conditions, dyslexia, that they all have different brain types. And the really key thing here is that those brain types aren't any more or less valuable than others. And I believe that it's the differences in our brain types that allow us to progress and approach problems in diverse, adaptive, and creative ways. But some autistic people and others who are neurodiverse may also face challenges. and they may need support or assistance in certain contexts. They might even identify with the term disability. But the idea that your brain type is valuable, and also that you might need support or assistance in some contexts, those two things shouldn't be mutually exclusive. With 1 in 44 people now being diagnosed every day, people are growing and changing and facing new challenges, just as we all are. But the research really hasn't caught up. So you're probably asking yourself, if autistic people are dying so much younger than others, what are we doing about this? And we know some of the reasons why this is, including high rates of mental health conditions, social isolation, and even risk of suicide. A study from last year in Denmark of 6.5 million people suggests that autistic individuals were over 3 times more likely to attempt and die by suicide than others. There are many possible explanations for these alarmingly high rates, including biological ones, like genetic overlap between autism and other mental health conditions, social reasons, like increased strain and exhaustion from having to mask autism to fit in, but also high rates of trauma and victimization reported by autistic people. A study done here at our Autism Research Center in Cambridge in 2019 suggests that autistic people were more likely than others to report 47 out of 60 adverse life experiences, including physical, emotional, and sexual abuse, as well as bullying and coercion. 47 out of 60. Differences in frequency of these traumatic events were not only striking, but also widespread, as autistic people were more likely to report at least one type of vulnerability across all of the 10 categories we investigated. The same study found that mental health symptoms were affected by these adverse life experiences. And I know that might seem like an obvious conclusion to draw, right? But it's actually really important, because in practice, this finding suggests that if we increase or promote safeguarding to prevent adverse life experiences, we might be able to help reduce high rates of mental health conditions. But we also need to think about whether or not current mental health treatments are going to be as effective for autistic people. As their social communication can be different, therapies reliant on talking, like cognitive behavioral therapy, may not be as effective and may need to be adapted. So, we know that autistic people have greater risk of mental health conditions, but what about physical health? We know from studies of children and young people that autistic individuals are more likely to experience things like seizures and epilepsy, gastrointestinal conditions, and sleep problems. But it's really surprising to find out how little we understand about autistic people's physical health as they age. So that's what I decided to focus on. I asked autistic and non-autistic people all about their health in a survey. I asked about their lifestyle, like their diet, exercise, and sleep, their sexual health, their substance use, their personal medical history, and their family medical history. And we recruited just under 2,400 autistic adults to participate, half of which were autistic and half of which were non-autistic. And these were almost exclusively the largest studies of their kind into the experiences of middle-aged and older adults. And unsurprisingly, based on research from younger people and children, we found that autistic individuals were more likely to have chronic health problems, like heart, lung, and diabetic conditions, and were less likely to meet minimal recommendations for diet, exercise, and sleep. But understanding that those challenges with lifestyle behaviors that start in early childhood, knowing that they extend into adulthood, was actually really critical to understanding risk of chronic disease among autistic people. And it begs the question of why we aren't doing more to help support autistic people in making healthy choices. But it's not really clear what would be best, be it better health education or increased mental health support, Or perhaps institutional changes, like employment and housing schemes, to help take off financial pressures and stress. Another core area that we looked into was the sexual orientation and gender identity of autistic people. And previous studies had suggested that autistic people are more likely to be LGBTQA+ than others. And I found that autistic people were less likely to be heterosexual and were more likely to be asexual or other sexual orientation. We also established that the majority of autistic people are engaging in sexual activity of some kind, breaking down incorrect stereotypes that autistic people aren't interested in sex. We found similar rates of sexually transmitted infections across the lifetime between autistic and non-autistic people, underlining the importance of equal access to high-quality, safe sex education for all. Similarly, in a study over 640,000 people using 5 data sets, including one I developed, we asked gender-diverse individuals, and by that I mean anyone who does not identify as cisgendered, so people who are transgender, non-binary, agender, genderqueer, and many other designations, that those gender-diverse individuals were 3 to 6 times more likely to be autistic, and they were more likely to have high autistic traits. Unfortunately, we know that LGBTQA+ people are still more likely to experience trauma, victimization, and harassment. And as I mentioned before, we know that autistic people are also at increased risk of these same kinds of things. So we need to think really critically about how we can best support and safeguard people with intersectional identities who might be at really high risk of abuse. We also need to think about the way that our language, the language of educators and healthcare professionals, but really of all of us, could be more inclusive and welcoming to people of all identities. The final area that we looked into was the substance use of autistic people. And we found that some autistic people were less likely to use substances than others, like drinking, smoking, using drugs. But for those that did use drugs, we found that they were more likely to do so to self-medicate for mental health and for behavior, including for autism. Many autistic people viewed this self-medication as positive, seeing it as an adaptive way of being able to better manage their own needs. And I'm of the opinion that we need more research into these areas and the legitimate medical uses of some of these drugs currently deemed recreational. But until that research is done, self-medication can be very dangerous. It can lead to unwanted drug interactions, increased risk of addiction or dependency, and also negative impacts on mental and physical health, including even death. But what I think this study most clearly highlighted is that current healthcare systems are not meeting the needs of autistic people in managing their unwanted mental health symptoms or their behavior. And this is really troubling because though there were no mentions of things like camouflaging or compensating within this study, there were indirect mentions of masking or minimizing autism using drugs. And that is concerning because those kinds of behaviors have been linked, though not causally, to increased risk of mental health symptoms and even suicide. There are many, many possible and valid criticisms of the studies I've outlined here today. One of the biggest ones is that they might not apply to all autistic or non-autistic people. They may be less likely to apply to people with co-occurring intellectual disability, which makes up about 15 to 35% of the autistic community today. The samples were also biased towards people who are white, those assigned female at birth, who live in the United Kingdom and the United States, and those who have a university-level education or higher. And despite the fact that many other studies using different samples and different methodologies, that they come to the same conclusions that we do, what I'm most interested in emphasizing is that we need more research in these areas, and more research into the experiences of autistic people who are LGBTQA+, those from diverse socioeconomic backgrounds, ethnicities, countries of origin, and with differing levels of intellectual ability. And this is urgent, because while limited in nature, The current research suggests dramatic gaps in quality of life, care, and support for autistic people. It suggests that autistic adolescents and adults are facing challenges that we don't fully understand, leaving policymakers, educators, and healthcare professionals in the dark about what we can do to help. So I actually want to challenge today's topic of restoration. Because from my perspective as a researcher, we need to totally reframe our approach to supporting neurodiverse individuals in order to provide equity. Policymakers, healthcare professionals, educators, and researchers all need to work collaboratively with autistic people to listen to what types of support or adjustments would have the biggest impact on their quality of life. I'd like to thank my funding bodies, my collaborators, and most of all the people that participated in this research. Thanks.